Welcome to the Vision Driven Marriage Podcast. If you're struggling in your marriage, or maybe you're wondering if it's even salvageable, before you give up or before you let things get too hard, let us come alongside you and help you solidify your marriage. We offer biblical encouragement and insight to help you strengthen your marriage.
Living through a traumatic event can cause emotional and physical reactions long after the trauma is over. These reactions are called trauma responses. According to the International Society for Traumatic Stress Studies, survivors may feel vulnerable and confused about what is safe, and therefore it may be difficult to trust others, even those whom they have trusted in the past. Today we are very blessed to have Ron and Halee Wood on the Vision Driven Marriage. Ron is a licensed professional counselor and a licensed alcohol and drug counselor. And Halee is a certified life coach and a certified relationship coach. And she is a trauma survivor. Halee often shares about her trauma response and how her husband Ron has helped her overcome many triggers. You can connect with Ron and Halee at runtheracetogether.com or on their free private Facebook group, The Simple Marriage. Let's listen in to our conversation.
Welcome, Ron and Halee.
Thank you, guys.
Thank you.
We're so glad to be here.
We are so glad that you've joined us here today. And as you talk about trauma in a relationship, it's something that a lot of couples deal with. And a lot of couples don't know how to talk about it, let alone know that they really need to talk about it. So can you tell us what trauma is and how it really affects relationships? And then tell us a little bit about how it's affected your relationship.
So, do you want to start off by telling them a little bit about what trauma is?
Sure. One of the things about trauma is some people would say it's a normal reaction to abnormal events. So, trauma is an emotional response to something terrible that that may happen to us, like an accident, natural disaster, assault, something like that. In some cases, maybe the person has been directly involved in what happened. In other cases, maybe you've witnessed something traumatic, and that can have an impact on you. So another definition of trauma would be going through very stressful, frightening, or distressing events. That's what I understand about trauma. Do you know anything different?
No, I mean, I would say that's a really great place to start. And there are different types of trauma. And so three that we typically like to talk about is acute trauma, chronic, and complex trauma. And so with acute trauma, that's something where you likely experience something one time. So an acute trauma for us is we were both present when my dad passed away, and it was not a peaceful passing away. That was an acute trauma. And you have chronic traumas, and chronic trauma is more of a repeated and prolonged. So domestic violence, abuse, something that has happened for a period of time. And something that people, especially in relationships, don't always assume is chronic trauma is when there is infidelity in the relationship, especially if they continue to do it, over the years and continue to be unfaithful. So that is a trauma that people
There's
experience.
a whole a whole treatment philosophy around betrayal trauma itself.
Betrayal trauma, yes. So we just we want to say that sometimes because people don't realize that is trauma, but it has such an impact on our brains and how we think and how we respond. It is a true betrayal and can create trauma for someone. And the last type of trauma that we talk about is complex trauma. And for complex trauma, it is typically being exposed to multiple types of trauma. And when I share our story with you, you're going to hear the complex trauma in my story and the fact that there are layers of trauma through the years. And so those are the three types of trauma that we talk about. And then within that trauma, we often experience something called triggers. Yes. Now, Ron is also a licensed alcohol and drug counselor. So when you're talking about triggers in that environment, often you're talking about something that makes you want to consume your drug or alcohol of choice. And that's not what we're talking about here. Right here, we are talking about the types of triggers that, well, there's kind of two types of triggers that we talk about. Do you want to tell them about those two types of triggers?
One can get us thinking about something that happened. It's a reminder, and we may get somewhat dysregulated, but maybe not too bad, but it gets us thinking about it.
It conjures up a memory.
It conjures up a memory, exactly. Another one is more of a reliving. So it's more than a memory. It's more of like, you will find yourself with the same thoughts, the same emotions, and even body sensations that you may have had at the time that you experienced a traumatic event. And we've seen that with Halee, especially, where, we'll probably talk about that later.
Yeah, so that is probably a pretty deep introduction to trauma and how it can affect us. And obviously when we're talking about triggers, that has a tremendous impact on our relationships.
I think that is a great introduction. And one of the things that we want to be able to give our listeners in the coming weeks is how to have a trauma-informed marriage. Yes. So this is an excellent definition, an excellent explanation of what it is, because sometimes there's a spouse that's experiencing the trauma and their husband or wives don't understand what their reaction is.
Right. And as we look at trauma in any person's life, it affects the way they respond to other things. And sometimes the response doesn't seem like it fits the current situation they're in. And in a relationship, it's so important to understand that, because otherwise you could believe things that aren't true as the trauma influenced partners dealing with things. If you don't realize what's going on, it could feel like it's your fault when it may not be. It could feel like you're a huge failure when that's not necessarily true. It's a direct reaction of the amygdala kicking in and the trauma-informed brain saying help.
Actually, if it's okay with you guys, maybe we can just give a brief description of what happens with the brain whenever those triggers happen. Because I think when we explain this, we see lights go on with people, with the spouse of the triggered partner, with the person who deals with the trauma. And they often are like, oh my goodness, I feel that. Like, I know exactly what you're talking about. And they feel seen. And the spouse is like, yes, I've seen that happen before. And so if it's okay with you, let's just take a minute to explain what happens in the brain when someone with trauma gets triggered. Do you mind explaining that?
No, and Doug, you just mentioned the amygdala, right? So the amygdala is known as the brain's smoke detector. So, which is just what you said, danger, danger. So that's housed in the midbrain. So we'll use this example. That's housed in the midbrain, and it's covered over by what we think of when we see a picture of the brain, the prefrontal cortex and all that. But this midbrain is really, it's one of its functions is to get us through the next 15 seconds alive, and so some of our survival instincts are fight, flight, and freeze. And so when we've been traumatized, it's believed that a lot of our memories might be connected somehow to the amygdala, or the amygdala senses, danger, but sometimes there's not a real threat. And again, we'll talk a little bit more about that later, but just for now, and what happens though, and there's a purpose to this, but we talk about, we can flip our lid. So when we get really, really anxious, or experience a trauma trigger, like our lid might flip, which really indicates that the prefrontal cortex, which is designed to help us make judgments and think through things, like all of a sudden it's not happening. And you can understand, like if you were a caveman and you're faced with a saber-toothed tiger, like you don't really need to think, well, maybe I should form a focus group and figure out what to do here. You need to act quickly. And so that's what this is designed to help us do. But in our modern society, like sometimes it again, we might act as though there's danger when there really isn't, or when the threat is past, but in our brain, it feels very similar. So our brain is kind of always pulling in things from past experiences to act on.
So a great example of that is if you had, like it's Independence Day and you hear a pop outside, right? So all of a sudden your amygdala is exposed because you hear this pop and it's like, danger. But if you don't have any traumatic experiences that sound like that, then, I mean, it just covers it back up. So whatever lid was flipped, I mean, it's just almost just as quickly, it covers your amygdala back up. But if you are a person who has been in combat and you hear that pop outside, that lid gets flipped and your brain is remembering last time I heard this noise, danger, 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 you need to react. You need to do something, right? And so what happens then is their lid can come back down, but it's at a much slower rate than someone who hasn't experienced that. And, I don't know if this is even right, I guess, technically, but for me, I know it's almost like, have you ever had your front door open and then had your back door open at the same time, and then your back door, you let it go and it should automatically close, but it doesn't because of the pressure systems in the house. It kind of ends up just staying open, and it's just kind of stuck open, kind of blowing in the wind. Sometimes I feel like that happens with our brains. That lid starts to come back down. It's like it gets stuck open a little bit and it just kind of goes in the wind. And so you become much more sensitive to scenarios and circumstances and things like that. And the amount of time that amygdala stays sensitive is going to vary per person, per scenario, and those sorts of things. And so
I had someone tell me the other day, she can be like that for days. Sometimes I think maybe hours, but she said it could be 3-4 days before she comes back to a normal way of thinking and feeling.
So I hope that's a helpful description to some of you that are listening. And I hope it helps it make sense, because we can feel like we're crazy, and the person who is with us can be like, what's wrong with you? Are you crazy? And the reality is, no, our body is doing what it was designed to do. God gave us this function of the brain to tell us danger, danger, danger. And your brain remembers like, hey, last time I was in a similar scenario as this, it wasn't good. And so part of, coming together and having conversations like this is the brain can often get retrained, so to speak, and we can learn to live within those scenarios and do things that can be incredibly helpful to us, so that when those moments come, we have a way to respond and do this together in a way that bonds our relationship rather than tear it apart. Because in all those descriptions, you can see why it can be so incredibly damaging. Because when someone's brain goes offline, it's hard to hold them accountable for anything, but yet you shouldn't be a punching bag, emotionally or physically. And it's like, so what do you do?
Well, and Doug talked about like, you might, if you're the non-traumatized person, you might feel bad or guilty. Something else I thought of is, when you don't understand why your traumatized spouse is acting that way, you can make it worse. Like, hey, what's your problem? Why are you acting like that? Cut it out. Don't talk to me that way, whatever, because it's hard to understand. Because like you said, sometimes these responses are more than the situation really might normally call for. It's bigger. It's this big response to this maybe relatively seemingly mundane situation.
Well, and I know that our listeners, some of them are relating to what you're saying right now, and because they're saying that describes what I couldn't put words to. Maybe somebody who's been through trauma said, I have felt like this doesn't make sense, even felt like it was crazy and I shouldn't be doing this, but I am. And a spouse who's got a traumatized spouse might be dealing with exactly what you were talking about, Ron. And so we know that it's not as unusual as people think it is. It's just not talked about as often as it ought to be. So what could you share that you all have learned through the course of figuring out how to better navigate post-trauma in a relationship?
So I have some individual trauma that I brought into the relationship, and then we have some shared trauma together. So ultimately, where my trauma began is at 12 years old, I was groomed by an older person. And eventually that led to sexual abuse, which led to a pregnancy when I was 14 years old. That pregnancy was ended with abortion. And then a month later, you guys, my best friend died in a car accident. And it was so traumatic because through that grooming process, I had really isolated myself anyways. That's something that a person in that position will do, is try to get you separated from anybody who loves you or cares for you. And so when my best friend died, I mean, loneliness does not even cover what I was experiencing. And I didn't even, this sounds crazy now, but at the time, I did not realize that I was actually being abused, because it was, the manipulation of my abuser and things like that. I just thought I was a really bad girl, And so it wasn't until I was in probably my early 20s and my abuser actually got arrested for doing something similar to someone else, that it all of a sudden hit me that it was abuse, and then it became much more apparent to me. And that around that same time is actually when I came into a relationship with the Lord. And oh man, I started realizing all the different ways that my abuse had affected me and decisions I was making that really was tied to that abuse, and it wasn't, just an excuse to then go behave these ways. I mean, it had just marked my being, I guess. I didn't know who I was apart from the abuse, and how to turn things around. And I came into a relationship with Jesus, and I think everybody always wants to hear, I came into a relationship with Jesus and everything got better. And I like to say, I came into a relationship with Jesus and it got worse because all of a sudden, I trusted him. And so I started becoming willing to be vulnerable and open up things that I had not been willing to do. And he made calls on my life that required me to dig deep. And that was hard and it was painful. Well, several years after that is when I met Ron. And so, man, I'd had so much healing and it was beautiful and wonderful. And so when we got married, I was able to tell him all about the abuse that I had overcome. And then when we got married, it was a new level of vulnerability for me that I had not experienced before. And so when I first began experiencing triggers, I didn't recognize them as triggers. Ron did not recognize them as triggers. We just were trying to figure out how to fix whatever it was that was going on with me, especially when we were, having sex and being physically intimate and all that kind of stuff. I was like, whoa, what is going on here? So that is one level of trauma that we experienced. And then in 2011, we had a son pass away. And so that was another level of trauma that we experienced together, just holding his body and saying goodbye to him. And that was also complex trauma in the fact that he died. I ended up having significant health issues that resulted in a 7-hour surgery for me just 2 months after he passed. And my mom actually died just a couple of months after he passed. So again, we were just kind of hit with this sorry. Thank you. It was just really this triple whammy, and we were at what I felt like was kind of a pinnacle, of our relationship, because we had gone through so much with the trauma from my past. And then we were just feeling so healed and good. And we were leading Celebrate Recovery. So if anybody's familiar with Celebrate Recovery, we just give it a woo woo. It really helped us. It was great. And we were leading Celebrate Recovery. And, we were at such a sweet spot in our relationship when that happened. And so we really had to take some steps back and say, okay, do we really believe all the things that we've been teaching and being a part of, and how can we apply them as we're going through the trauma, rather than, 15 years after the trauma, and so that gave us the biblical principles to really be able to dive in and use them as we were going. And so those are some of the traumas that we have had separately and together. And I share that because, I just want to let you guys know some of how that has affected our relationship and some of what Ron has had to put up with. And, I've had the triggers that just turned up memories. And then I've had triggers where it's actually a reliving. And most of those were most of the time now, I only have triggers that bring up memories. But every once in a while, still, I have a reliving. And in fact, last May, we had a huge scenario where we were in a drive-through and I had a reliving trigger. It was so bizarre. I mean, it was to the point that I even got out of the car and started walking. We were out of state. And Ron was just like, whoa, what just happened? And in my mind, I was essentially kind of in a different place. And it was so scary. Our children were there. And
mom was there.
Yeah, his mom was there. Don't tell anybody, but she just kept telling him that he needed to pull over and get me wine afterwards. It's like, no, she doesn't need wine. Like we're gonna, just stay calm. We're gonna get there.
I didn't exactly know exactly what to do, but I did mention to my mom, who is a very, very loving person. I know she just does not want to see anybody that dysregulated. I knew she was going to want to, try to do some fixing. And I said, Mom, when she gets back in the car, don't say anything. Don't do anything. I've got this. It's going to be okay. And that really comes from trusting Halee. Like, I know that she is going to figure it out. But like, essentially, my plan was nobody do anything. Don't do anything. And I think that's exactly what needed to happen. And so kind of to your question, well, did you need to describe what happened?
Well, I don't know that I need to describe what happened, but I think that's really a good lead in. What do you do when those sorts of things happen as the person standing by? And I can talk a little bit to the, the traumatized person as well. But, the question is, what do you do as the onlooking person?
Right. I think one of the things is try to recognize when your spouse's reaction seems over the top for the situation you find yourself in, and allow for some kind of a cool down period. Just take a break, take a time out. Again, we talked about this a minute ago, but don't try to not take it personally and get on the defensive. Because I'll tell you, when Halee got triggered in that way, it was I hadn't seen her like that in a long time. She was pointing at me. She was almost even cussing at me. And but even in that moment, I thought to myself, I don't think I did anything to deserve this. Like, something strange is happening here. And I didn't respond. I didn't do anything, but I could see how in another life, I would have been like, hey, you don't need to be talking to me like that. You need to just calm down, or something that's not going to make it any better. So a couple of things just from that experience that I learned is, just recognize when that it's over the top for the situation you're in, and allow for a cool down, and don't take it personally. If the reaction is not an obvious fight, flight, or freeze response, try to calmly ask some clarifying questions about what they might be thinking and feeling, but give some space.
And one thing we have found often is to ask those clarifying questions sometimes just needs to be later.
Yeah, just later.
Right.
You can ask like, hey, what is helpful to you now, or something like that. But if you really want to have a conversation about what's going on, I would say generally try to let their brain reseat. And then say, is this a good time to talk about what happened? And make a plan then for even if it were to happen again, those sorts of things. But often conversations in those moments, I know we don't want to sweep things. I'm not talking about sweeping things under the rug. No. I'm talking about coming back later when both of you are in a healthier space to have that conversation. I don't even think it's fair to ask the triggered person to engage in a reasoning conversation because, the part of their brain that can do that is offline.
Right. Right. So you want to try to decrease that emotional reactivity that's going to keep the person in the fight, flight, or freeze. And for the non-traumatized spouse, try to tolerate those uncomfortable feelings that are arising without engaging in any kind of defeating behavior that's going to, mess with the relationship, maybe, harm the person who's already dysregulated.
Yeah, because it's so easy for us to get on the defensive. If we don't realize that our spouse is triggered and then they're reacting in a way that puts us on the defensive, and then it's game on,
Yeah.
Right. A client one time said it to me very well. She said, "Love me until I'm me again." And I thought that was really, really well put, and that kind of explains that whole process of like, okay, I'm extremely dysregulated right now. I'm not really me. And, we're not really talking about it, but there's the concept of dissociation. I'm not really me, but can you love me until I'm me again? And then we can come back and have a conversation like Halee and I did. I think it was maybe a day later. We were out for a walk and she said, "I think I know what happened." And she was but she spent some time going over it, putting the pieces
And
back
praying
together.
about it and asking God for some clarity. And, because those moments are really scary, because it's like, man, if it happened this time, how do I know it's not going to happen again? Or, something like that. And they can be really scary. So it is good to come back together because neither of you desire that.
right?
Right. That's not something either of you want. And so, one thing I think is important for Ron to talk about here is I want to give a lot of grace and space to the person that has been traumatized. But what we have to realize is that one thing that is so difficult with trauma and especially abuse survivors is that the person who's on the receiving end of that is not the only victim. When we get married, they become a shared victim in that. And so, we need to also have grace and space for the spouse who is on the receiving end of that. And, I want the spouse to, have patience and endurance and all the things that Ron was talking about, but it's so important for that person to also take care of themselves. They do not need to just be a punching bag. And so I would like to ask you to maybe share what are some things to do to take care of yourself when you're in that situation, the spouse of the trauma survivor.
One thing I think it's you try to remain calm all the time, but it doesn't hurt to set some necessary and appropriate boundaries in your relationship. To mention, like I don't think I deserve that right now, or I think something's going on. Maybe call a timeout or something like that. But to have some appropriate boundaries. Reach out to others for help when you need it. I know early on in our marriage, I was with a group of men who they were older than I was. I just happened to be the youngest guy in the group, but they had been through this for years and could speak into like some of my situations. So I had a place to talk about that kind of stuff, and try to create some new rhythms. Try to understand each other, learn some new skills, learn some new even terminology for communicating with each other, and trying to understand when the situation is getting out of control before it gets too far gone. And before, again, if there's name calling or any kind of abuse or something like that, it's okay to set a boundary and say, okay, I understand that you're upset right now and I'm sorry. What would be most helpful to you in this situation? Calling me names isn't appropriate, right?
Yeah. Well, and I think it's important to say here, Ron said that when I had that trigger, one thing that helped him to remain calm is because he trusted me. And so the first thing I would say to the trauma survivor is our trauma is not our fault, but our trauma response is our responsibility. I'm sorry. I know you didn't ask for it, but that is the reality of it, right? And so that means, just continue to pursue, health and wholeness, spiritually, emotionally, physically. Like, do those things to just honor your body and learn more about your body and your brain. And one of my favorite things to have realized is that when you've experienced trauma, one of the first things that gets affected is our ability to imagine. And so I've kind of like challenged my brain to, that's what worry is. It's just like imagination used differently, right? And so like when it comes to so many of the things that trigger horrible things, if it's something that's coming up for me consistently, I like to try to use my imagination to reimagine what that situation would look like. Or, what if when Ron tells me how he would like his peanut butter and jelly sandwich, he's not actually saying that I'm a complete idiot, right? Like that was one of our earliest fights in our marriage. Like, I thought he was telling me how stupid I was. And I mean, all he said was like, hey, if you're making me a PB&J, like do it like this, and I was like, what? And so, it's like, what if I reimagine that Ron was actually just trying to let me know how he likes his peanut butter and jelly sandwich? What might happen after that scenario if I were to respond with peaches and roses, or whatever it is, it's just like using my imagination, and even on a more powerful note, using my imagination to like see the Holy Spirit like coming out of me and defending myself against whatever those thoughts that are coming at me, and that was very powerful for me on numerous occasions, to help me with nightmares that I was having and, other things that were happening there. And so that was powerful, pursuing a mental health counselor. EMDR is a technique that's out there right now. To me, like putting that together, especially with what I know about the Holy Spirit and believing that the Holy Spirit can use that in me, was so powerful and so helpful. So just keep pursuing health and wholeness spiritually, emotionally, and physically. And so that will help you to give grace to yourself. And also that gives you an opportunity to not shame or deny your partner's reality. Because if I can release the shame off of myself, then I don't have to defend myself, because if I see he's hurting, I want to almost like downplay that, because then I feel responsible for it, right? So, but if I'm pursuing spiritual and emotional wholeness, I can release myself from the shame, which in turn lets me be united with my husband and say, yeah, you are hurting. That makes sense to me. Instead of being like, well, you don't even know, like my thing was so much worse and you're, just being whatever about it. It's like all of a sudden I can see his pain and know something I did may have kind of brought that about, but together we can acknowledge it and pursue healing and hope in our marriage. And so that communication then can open up and you can start working through those things together, rather than me being over here in this corner and him being over here in this corner. One tidbit of information I will say that we have learned from our experience that I hope is really helpful to people is when we, especially in our physical intimacy, first we're just having problems and it was stirring up so much stuff in me, all I could think is, Ron must be doing something wrong. And so it feels a lot like blame, because I did not realize it was triggers. So I was like, well, it's probably because you need to do this, or probably because you need to do that. And, at some point in time, Ron's like, man, you just kind of keep changing the story on me.
The whole line keeps moving. You gave me this checklist. I checked off. Now I got a whole new checklist.
And we see that a lot with couples, by the way. They're like, well, he or she is just always moving the finish line. Like, they told me if I just did this, if I just did that. And so I want to change and encourage people to change how they communicate about what they think will be helpful. is that when you share something that you think will be helpful, instead of pretending like your partner needs to do it for a lifetime, say, I'm not really sure what's going to be helpful, but I would like to try blah, blah, blah. And then you try it for a little while and you come back and say, so was that thing actually helpful? Oh, no, it wasn't that helpful, or this part of it was. So let's tweak it a little bit and let's try something else. I mean, it just helps, I think, to reframe it, because it's not a blaming thing. It's like, I really don't know. This is very complicated for me too, but I want to keep trying, and I want to keep inviting you into the trying with me, and just try it for a little while, or once. I mean, because you may try it once and figure out it ain't where we need to go, and just try it once, twice, something like that, and then just reshape it or throw it out altogether, whatever you need to do. I think that will help the spouse feel like they are not getting blamed for what is happening, and it'll keep you united as you continue to try things to help your marriage grow, instead of always just creating all these, because look, there are some things for us that are off bounds because of the abuse. But there are a lot of things that we have been able to continue to grow through by just trying it little steps at a time and figuring out what is actually a good thing for us to do, and doing it safely in unity with one another.
Well, and that gives the spouse a sense of control, because again, if the checklist keeps changing, if the goal line keeps moving, I don't feel any control in the relationship. I don't feel like I have any agency. So this gives the spouse a sense of control to just work together, try these things, like what you're saying.
Yeah.
And what a beautiful example of how honesty in that relationship can be a practical way to live out the biblical truth that we're to consider others as more important than ourselves, in conjunction with God calling us to realize that we're one. What incredible practical advice, both for the spouse who's been through trauma and the spouse who's loving the spouse who's been through trauma. It's one of those things where there's always so many things that we can do, and it's a process. I'm so grateful that you shared so much about the process you've been through.
Well, thank you. And I will say, neither of us, I know some people are like, I know the verse, consider it all joy, but neither of us are really grateful for the traumas that we've endured. Yeah. What I will say is that I believe, though, that the things that we have had to grow through has created a tremendous amount of trust and intimacy in our relationship. I believe that our relationship is at a level of intimacy that I never dreamed of. And it is because we kept coming together in these things and having patience for one another. It wasn't always easy. I mean, initially we would have talks for hours and hours that were draining and those sorts of things. But you guys, we kept coming back to the table and kept pursuing that wholeness and healing. And like, I am just so grateful that I have a safe place to be broken, because it takes the shame away from being broken. Mm-hmm. And that's grateful for.
Thank you so much for sharing all of that. That was amazing. And I know that God's going to use that to help people in some amazing ways. We want to make sure in just a moment that anything else that you feel like you really want to share, you have an opportunity to do that.
Along with what you're saying, Doug, something that we encountered when we did our Facebook Live about this is somebody said, I watched your Facebook Live and I started looking around my house and thought, oh my goodness, there's so many people here that have experienced trauma and I never knew it. And he just said, this kind of gives me a framework. He's like looking at his whole family through a different lens, and I just thought, well, that's pretty incredible, and he kind of admitted, he's like, I don't think I've been doing much to make it any better for anybody, so that was pretty awesome.
Well, isn't that the case? When the trauma affects your ability to imagine, it also affects our ability to be empathetic.
Mm-hmm.
Yes, It does.
Yep.
It does. And Halee talked about that, sometimes it's like, well, okay, yeah, you've been through this, but I've been through I've been through that. It's funny. I saw this Far Side cartoon that kind of typified that. It's these two sailors, and this one sailor, he's saying, "Yeah, that's a pretty good story, but did I ever tell you how I got this?" And he's pointing to a peg leg, and the guy he's talking to has a peg for a head, and he's got a little sailor's cap on it. Yeah, that's a pretty good story. But let me tell you how I got this peg leg. And it's just like, man, that's like the ultimate and like trying to one up somebody, you know? Like, so
Yeah. Oh, goodness. Well, Ron and Halee, where can we find you?
Well, we are at our business is runtherace.together.com. So you can always find us there. Everything you need to know about us is there, all of our links and things like that. But specifically, because we see clients individually and we see couples together. So that's super fun, both of those things. And you can find all that on the website. But specifically for couples, we do have a free private Facebook group called The Simple Marriage. And it's not because we think that marriage is necessarily simple, but we believe that when we live by certain biblical principles and the other things that we have learned and, professionally and personally, that we can certainly make marriage simpler. And we want people to be able to experience that and share in that. So The Simple Marriage is the Facebook group, and runtherace.together.com.
Wonderful. And all those links will be in the show notes.
So, well, thank you
guys.
guys.
Thank you guys for joining us. We're so happy that you did.
thank you. Thank you for having us. We're glad to have this opportunity to talk about this, and I really hope and pray that it's helpful.
And for anybody who's listening, our hearts and our prayers are for you, and God's heart is for you and not against you. And we're so grateful that we have these spaces to come together and grow and learn together. So thank you guys for hosting, Doug and Leslie. We really appreciate it.
Wasn't that a great conversation with Ron and Halee Wood? We are so grateful that they joined us on the Vision Driven Marriage to share their expertise. Ron and Halee have developed a resource for you called 7 Tips for a Healthy Trauma Response. This free article helps husbands and wives understand a common trauma response called hypervigilance and the steps toward hope and healing. We hope you will utilize this free resource provided by Ron and Halee Wood at Run the Race Together. All the links are in the show notes.